Hello, everyone, and thank you for attending my speech. As legal philosopher Ronald Dworkin once stated, making someone die in a way that others approve, but he believes is a horrifying contradiction of his life, is a devastating, odious form of tyranny. This could not be further from the truth when it comes to the ethical implications of euthanasia. I believe that it is extremely important for us to consider how self-determination and autonomy play a role in the freedom of choice and will that we have, and how that should extend to every aspect of our lives from the moment that we come of legal adult age to the moment that our lives near the end. As a current social work student enrolled in ethics and values classes, I have come to the realization that every client has a right to self-determination, and as stated in one of my social work books, individuals ultimately know what is best for them and should ultimately be the final decision makers in every aspect of their lives. This includes, of course, end of life decisions and what to do when presented with the option to continue living in pain and suffering from a terminal medical condition. I believe that passive and voluntary euthanasia should be legalized since it is moral and ethical to respect what an individual ultimately wishes to do with their lives. And it is not up to us to decide that for ourselves because of our own values and ideas. Um, so I think it is important to analyze and cover this topic since it is fundamental that we understand that we as individuals have the right to decide what is best for us. And at some given point in our lives, we may find ourselves in the same situation and with the same options in mind. Um, I believe that legalizing euthanasia will respect the value and the rights of self-determination that people have. And the ideal that we possess the will and choice to decide what is best for each and every one of us. This is a choice that is dictated entirely by us as individuals and not by things like politics, policy, um, or the personal opinions and values of other people. Um, And legalizing euthanasia will allow for suffering and pain to cease at the control of the terminally ill individual and will allow for a dignified and respectable death in contrast to a painful and diminishing one. It is often considered to be far more inhumane and barbaric to extend a person's life against their wishes and against their will for personal, political, or religious views, than it is to respect their wishes and the autonomy that they possess to dictate what they wish to do with their lives. Um, in legalizing euthanasia, this will allow for others to utilize the resources and treatment that one individual may no longer wish to receive. Um, Other people may not wish to be euthanized and they may be in urgent need for the resources and treatment that another may no longer wish to have. So this shows that euthanasia is not a selfish and desperate act, but rather a role that can have a positive effect and impact on others. The plan is to legalize voluntary euthanasia and to normalize it as a respectable and serious decision that carefully considers the will, wishes, and the self-determination of the affected individual. This is a process that will ultimately involve patient meetings and medical examination to determine whether a patient is competent to make the decision, assignment of decision maker in case the patient becomes incompetent to decide, medical examinations to provide prognosis and mortality rates of the condition of the illness, and obviously legal matters regarding last will and testaments. Uh, Once a decision has been made, there are multiple factors that must be considered. There will obviously be a financial impact that will reduce the severity of medical costs, as well as availability of treatment for other patients. So planning personal and financial affairs will also be necessary, such as funeral arrangements, financial assistance, dealing with insurance policies and changes that will occur because of the death. Um, Emotional and moral support also has to be considered as a natural part of the plan, and will most likely involve the roles of clinical social workers. Finally, legal matters regarding will and testament must be considered and arranged within that period of time, obviously all revolving around the wishes and decisions of the patient. This plan is the overall best decision when it comes to legal euthanasia, I believe, because it is a comprehensive and complete plan that will ultimately revolve around the needs and choices of the client, of the patient, with the intent to minimize pain, suffering, and financial burden. In this way, the client can resolve and settle personal affairs and plan accordingly for what will happen after death, all while remaining competent and strong enough to make those decisions for themselves. There are those who object, and obviously those who object often do so for religious reasons. Um, the belief in the sanctity of life and the role of God's plan is often the main argument used to oppose euthanasia. It is important to consider, however, that euthanasia, much like religion, should be an entirely personal choice and legal right, and should ultimately be decided by the individual in suffering and not so much the ideals and beliefs of others. Likewise, those who wish to extend treatment and not undergo euthanasia have every right to do so if they wish. So to me, this seems to be an issue that should concern first and foremost the individual who is experiencing the illness. It should always be focused around the issue of end of life and how someone is in considerable discomfort or pain, um, should get to decide what they wish to do with their health care and how they wish to handle it. Personal quality of life is extremely important to some individuals, and sometimes it can be extremely damaging and traumatic um, to experience that with the aggravation of a terminal illness. I think sometimes it is important for someone to know that they can decide on having a dignified way to go when they feel like they still have the opportunity to decide so for themselves. That is the ultimate form of respect to self-determination, free will, and autonomy. The word euthanasia comes from the Greek words eu, which means good, and thanatos, which means death. This translates to good death, which is what hopefully we'll have the opportunity to encounter someday when our time comes. Thank you.